Why it's important to examine your inner child. The concept of the inner child involves a journey of self-awareness, healing, and growth. By addressing and healing past wounds, individuals can achieve greater emotional freedom, healthier relationships, and a more fulfilling life. Whether you are drawn to the holistic and spiritual aspects of New Age practices or the structured, evidence-based methods of psychological therapy, inner child healing can be a transformative journey towards wholeness and well-being. Understanding and addressing our inner child allows us to examine how early experiences shape our adult lives, influencing our behaviors, relationships, and emotional well-being. By exploring our inner child, we can uncover the roots of our emotional responses and behaviors, leading to a more balanced and fulfilling life. Recognizing the need to heal your inner child can be crucial for emotional well-being and personal growth. One of the primary symptoms is emotional reactivity. This can manifest as experiencing intense emotional reactions to seemingly minor events or feeling overwhelmed by emotions such as anger, sadness, or fear without clear reasons. These reactions often indicate unresolved emotional wounds from childhood that need attention. Another significant symptom is persistent feelings of inadequacy. Individuals may struggle with low self-esteem and self-worth, frequently feeling unworthy, unloved, or not good enough. These feelings can stem from negative experiences or messages received during childhood, which continue to affect self-perception in adulthood. Difficulty in relationships is also a common indicator. This can include repeating unhealthy relationship patterns, such as codependency or avoidance, finding it hard to trust others or maintain close connections, and feeling overly dependent on others for validation and support. These patterns often reflect unresolved inner child issues that influence how individuals relate to others. Self-sabotaging behaviors are another symptom to watch for. Engaging in behaviors that undermine success or happiness, such as procrastination, substance abuse, or self-criticism, and avoiding opportunities for growth or change due to fear of failure or rejection, can signal the need for inner child healing. These behaviors often serve as coping mechanisms for deeper emotional pain. Fear of abandonment is a further sign. Experiencing anxiety about being abandoned or rejected by loved ones, and clinging to relationships even when they are unhealthy or unfulfilling, can indicate unresolved childhood fears and insecurities that need to be addressed. Difficulty setting boundaries is another symptom. Struggling to assert needs and desires, and feeling guilty or anxious when saying no or setting limits with others, can reflect a lack of self-worth and fear of rejection rooted in childhood experiences. Chronic feelings of loneliness can also suggest the need for inner child healing. Feeling isolated or disconnected from others, even in social situations, and experiencing a sense of emptiness or longing for deeper connections, often point to unmet emotional needs from childhood. Perfectionism is another indicator. Setting unrealistically high standards for oneself and feeling distressed when these standards are not met, along with being overly critical of oneself and others, can stem from a desire to compensate for feelings of inadequacy rooted in childhood. Avoidance of emotions is a further symptom. Suppressing or ignoring emotions, leading to numbness or detachment, and using distractions or unhealthy coping mechanisms to avoid dealing with feelings, can indicate unresolved emotional pain from childhood. Finally, recurring negative thoughts can signal the need for inner child healing. Having persistent negative thoughts about oneself, abilities, or future, and struggling with feelings of hopelessness or despair, often reflect deep-seated emotional wounds that need to be addressed. If you recognize these symptoms in yourself, it may be beneficial to explore inner child healing. This process can help you address unresolved emotional wounds, develop healthier coping mechanisms, and build a more positive and fulfilling life. Understanding the inner child. Understanding the inner child begins with recognizing its significance in our lives. The inner child represents the part of us that retains the feelings, memories, and experiences of our childhood. These early experiences, whether positive or negative, have a lasting impact on our adult lives. By acknowledging the presence of our inner child, we can start to understand how past experiences influence our current behaviors and emotional responses. This awareness is the first step towards healing and personal growth. Awakening and awareness. Awakening to the presence of our inner child involves becoming aware of suppressed emotions and memories. This process is crucial for self-awareness and healing. Techniques such as meditation, journaling, and guided visualization can help individuals identify and connect with their inner child. By bringing these hidden aspects of ourselves to light, we can begin to address unresolved issues and emotional wounds. Self-awareness allows us to understand the origins of our feelings and behaviors, paving the way for healing and transformation. Healing the inner child. Healing the inner child involves connecting with and nurturing this vulnerable part of ourselves. Techniques for emotional healing include practices such as inner child dialogues, where individuals communicate with their inner child through writing or visualization. This process helps to validate the inner child's experiences and provide the support and nurturing that may have been missing during childhood. Forgiveness and self-compassion play vital roles in this healing journey, allowing individuals to release past traumas and embrace a more compassionate relationship with themselves. Integration and growth. Integrating the inner child into adult life is essential for achieving emotional wholeness and resilience. This process involves embracing vulnerability and authenticity, allowing the inner child to coexist with the adult self. By integrating the inner child, individuals can access a deeper sense of emotional balance and strength. This journey towards integration encourages personal growth, helping individuals to become more resilient and emotionally whole. Tools and practices. Various tools and practices can support inner child work, including meditation, visualization, and other therapeutic techniques. These practices create a safe and supportive environment for self-exploration and healing. Practical exercises such as creative expression, affirmations, and mindfulness can help individuals connect with their inner child and facilitate emotional healing. By regularly engaging in these practices, individuals can foster a deeper connection with their inner child and promote ongoing personal growth. The role of relationships. Relationships play a significant role in triggering inner child wounds and providing opportunities for healing. Understanding how relationships can activate these wounds allows individuals to navigate and heal within the context of their interactions with others. Building healthy, supportive connections is crucial for emotional well-being. By addressing inner child issues within relationships, individuals can develop more authentic and supportive connections, enhancing their overall quality of life. Examining and healing the inner child is a transformative process that offers profound benefits in emotional healing, self-esteem, relationship health, and personal empowerment. By addressing the roots of our emotional wounds and integrating the inner child into our adult lives, we can achieve greater emotional freedom, healthier relationships, and a more fulfilling life. People should engage in inner child healing. Benefits of New Age Inner Child Healing. Engaging in New Age inner child healing offers numerous benefits that contribute to holistic well-being. This approach combines emotional, physical, and spiritual healing, promoting overall balance and harmony. By addressing all aspects of the self, individuals can achieve a more integrated and peaceful state of being. New Age practices encourage personal empowerment by fostering self-exploration and self-discovery. This journey leads to greater self-awareness and empowerment, allowing individuals to reclaim their personal power and live more authentically. Additionally, New Age inner child healing integrates spiritual practices, offering a deeper sense of purpose and connection. This spiritual growth helps individuals feel more connected to themselves, others, and the universe, providing a profound sense of fulfillment and meaning. Benefits of psychological inner child healing. Psychological inner child healing also provides significant benefits, particularly through its use of evidence-based techniques. These scientifically validated methods effectively address emotional and psychological issues, ensuring that individuals receive reliable and effective treatment. The structured approach of psychological healing provides a clear framework for understanding and resolving inner child wounds. This structure helps individuals navigate their healing journey with confidence and clarity. Moreover, psychological approaches offer professional support from trained therapists who can tailor interventions to individual needs. This personalized guidance ensures that each person receives the specific support they need to heal and grow. New Age versus psychological approaches. Definitions and philosophies. New Age inner child healing focuses on holistic healing, integrating spiritual, metaphysical, and energy-based practices to address inner child issues. This approach often emphasizes personal empowerment, spiritual growth, and the interconnectedness of mind, body, and spirit. By incorporating a wide range of practices, New Age healing aims to create a comprehensive and balanced approach to well-being. In contrast, psychological approaches are grounded in scientific research and evidence-based practices. These methods use established therapeutic frameworks such as cognitive behavioral therapy, CBT, psychodynamic therapy, and attachment theory to address inner child wounds. The focus is on emotional and psychological healing through structured therapy, providing a clear and methodical path to recovery. Spiritual and metaphysical insights. Exploring the interconnectedness of mind, body, and spirit in healing suggests utilizing spiritual practices such as mindful meditation, journaling, and visualization to name a few. Inner child dialogues. A technique frequently mentioned involves directly communicating with the inner child. This may include writing letters to the inner child, engaging in dialogues during meditation, or visualizing interactions with the younger self. The purpose is to listen to the needs and feelings of the inner child, validate their experiences, and provide the support and nurturing that may have been missing during childhood. Creative expression. Engaging in creative activities such as drawing, painting, or playing musical instruments is another method mentioned for healing the inner child. These activities allow for the expression of emotions and can help reconnect with the playful and spontaneous aspects of the self. They provide a safe outlet for the inner child to explore and express feelings without judgment. Affirmations and positive self-talk. Using affirmations and positive self-talk can help reprogram negative beliefs and self-perceptions that stem from childhood experiences. The document suggests creating and regularly repeating affirmations that resonate with the inner child's needs, such as, "I am safe," "I am loved," and "I am worthy." This practice helps reinforce a positive self-image and promotes emotional healing. These tools and techniques provide a holistic approach to inner child healing, addressing physical, emotional, and spiritual aspects to foster a sense of completeness and well-being. Tools for inner child healing. Visualization techniques. Visualization is used to connect with the inner child by creating a safe and nurturing mental space where the child can express feelings and thoughts. This technique helps in understanding and healing childhood wounds by imagining a comforting and protective scenario for the inner child. Journaling. Writing letters to the inner child is a therapeutic practice that allows for the expression of suppressed emotions. This tool helps in identifying unresolved issues from childhood and provides a way to communicate and comfort the inner child. Role-playing. Engaging in role-playing exercises helps in practicing how to voice needs and set boundaries. By simulating real-life situations, individuals can rehearse and build confidence in their ability to assert themselves. Affirmations. Positive affirmations are used to reprogram negative beliefs that the inner child holds. Repeating affirmations like, "I am worthy of love and respect," helps in building self-esteem and self-acceptance. Meditative mindset. Meditative practices are employed to connect with different parts of the self, including the inner child. This approach facilitates deeper emotional healing and integration of the inner child's needs and feelings into the adult self. Exercises for inner child healing. Letter writing. One exercise involves writing a letter to the inner child, expressing understanding, love, and validation for the child's experiences. This exercise helps in acknowledging and healing past wounds. Creative expression. Engaging in creative activities such as drawing or painting as the inner child can be a form of emotional release and expression. It allows the inner child to communicate feelings that may be difficult to verbalize. Dialogue with the inner child. This exercise involves having a written or spoken dialogue with the inner child. Asking the child how they feel, what they need, and reassuring them of their safety and worth helps in fostering a nurturing relationship. Setting boundaries. Practicing setting boundaries in various scenarios helps the inner child feel protected and valued. This exercise involves identifying situations where boundaries are needed and role-playing how to assert them. Reparenting. This exercise involves giving the inner child the love, care, and support that may have been missing during childhood. It includes comforting the inner child, providing reassurance, and fulfilling unmet needs. A comparison of New Age inner child healing versus psychological approaches. Some similarities. Focus on emotional healing. Both New Age and psychological approaches emphasize healing emotional wounds from childhood. They recognize the impact of past experiences on present behavior and mental health. Use of visualization and imagery. Techniques such as visualization and guided imagery are common in both approaches. These methods help individuals connect with their inner child and address unresolved issues. Journaling and creative expression. Both approaches utilize journaling and creative expression as tools for healing. These methods allow individuals to process and articulate their emotions in a constructive way. Role-playing and behavioral rehearsal. Both approaches include role-playing exercises to practice new behaviors, such as setting boundaries and asserting oneself. The differences. Spiritual and metaphysical elements. New Age inner child healing often incorporates spiritual and metaphysical elements such as energy healing, chakra balancing, and working with spirit guides. These elements are typically not present in traditional psychological approaches. Therapeutic framework. Psychological approaches are based on established therapeutic frameworks such as cognitive behavioral therapy, CBT, psychodynamic therapy, and attachment theory. These frameworks provide structured methods for addressing inner child issues. Use of affirmations. New Age practices frequently use affirmations to change negative thought patterns and beliefs. While affirmations can be used in psychological therapy, they are more central to New Age healing. Meditation and mindfulness. Meditation and mindfulness practices are integral to New Age inner child healing. While mindfulness is also used in psychological therapy, the New Age approach often combines it with other spiritual practices. Integration of past life regression. Some New Age practitioners use past life regression to address inner child wounds, believing that unresolved issues may stem from previous incarnations. This concept is not recognized in traditional psychological therapy. In summary, while both New Age and psychological approaches to inner child healing share some common techniques, they differ significantly in their incorporation of spiritual and metaphysical elements, therapeutic frameworks, and specific practices. What inner child healing solves or heals? Emotional healing. New Age inner child healing aims to address and heal deep-seated emotional wounds, often stemming from childhood trauma. This approach can lead to greater emotional freedom, reduced anxiety, and improved overall well-being. Techniques such as energy healing, meditation, and visualization help release trapped emotions and promote emotional balance. By addressing these deep-rooted issues, individuals can experience a significant reduction in emotional distress and an increase in overall happiness and peace. Psychological approaches focus on understanding and resolving emotional issues through structured therapy. Techniques such as cognitive behavioral therapy, CBT, are used to help individuals reframe negative thought patterns and develop healthier emotional responses. By working with a therapist, individuals can gain insights into their emotional triggers and learn effective coping strategies. This structured approach ensures that emotional healing is grounded in scientifically validated methods, providing reliable and effective results. Self-esteem and self-worth. New Age practices like affirmations, visualization, and energy healing are powerful tools for building self-esteem and self-worth. These practices help individuals replace negative self-beliefs with positive ones, fostering a more positive self-image. Affirmations such as, "I am worthy," and "I am loved," can reprogram the subconscious mind, leading to increased confidence and self-acceptance. Visualization techniques allow individuals to see themselves in a positive light, reinforcing their sense of worth and potential. In psychological therapy, therapists work with clients to identify and challenge negative self-perceptions. Evidence-based practices like CBT are often used to help individuals build a more positive self-image. By addressing the root causes of low self-esteem and developing healthier thought patterns, individuals can improve their self-worth and overall mental health. This therapeutic process provides a structured and supportive environment for personal growth and self-improvement. Relationships. Healing the inner child can significantly improve relationships by addressing patterns of behavior rooted in past trauma. New Age practices encourage individuals to explore and heal these patterns, leading to more authentic and healthier interactions with others. Techniques such as inner child dialogues and energy healing help individuals release past traumas and develop healthier relationship dynamics. This healing process fosters greater emotional intimacy and trust in relationships. Psychologists help individuals understand how past experiences influence current relationship dynamics. By offering strategies to improve communication and emotional intimacy, therapists guide clients in developing healthier and more fulfilling relationships. Techniques such as talk therapy and behavioral rehearsal are used to practice new ways of interacting and resolving conflicts. This structured approach ensures that individuals can build strong, supportive connections with others. Personal growth and empowerment. New Age practices encourage personal growth by integrating spiritual elements, fostering a sense of connection to a higher self, and promoting overall empowerment. Practices such as meditation, energy healing, and spiritual guidance help individuals explore their inner selves and discover their true potential. This journey of self-exploration leads to greater self-awareness and empowerment, allowing individuals to live more authentically and purposefully. Psychological approaches provide tools for personal development through self-awareness, coping strategies, and behavioral changes. Therapists work with clients to identify areas for growth and develop practical skills for managing life's challenges. Techniques such as mindfulness, CBT, and journaling are used to enhance self-awareness and promote personal growth. This structured approach ensures that individuals have the support and guidance needed to achieve their personal development goals. By addressing and healing inner child wounds, individuals can experience profound benefits in emotional healing, self-esteem, relationship health, and personal empowerment. Whether through New Age practices or psychological therapy, inner child healing offers a transformative journey towards wholeness and well-being. Techniques and exercises. New Age approaches. Visualization and meditation. Visualization and meditation are powerful tools in New Age inner child healing. These techniques involve creating mental spaces where the inner child can express and heal. By visualizing a safe and nurturing environment, individuals can connect with their inner child, allowing suppressed emotions and memories to surface. Meditation helps in calming the mind and fostering a deeper connection with the inner self, facilitating emotional release and healing. Energy healing practices such as Reiki, chakra balancing, and sound healing are integral to New Age approaches. Reiki involves the transfer of universal energy through the practitioner's hands to promote healing and balance. Chakra balancing focuses on aligning the body's energy centers to release trapped emotions and enhance well-being. Sound healing uses vibrational frequencies from instruments like singing bowls and tuning forks to clear energetic blockages and promote emotional harmony. Affirmations and positive self-talk. Affirmations and positive self-talk are used to reinforce positive beliefs and self-perceptions. By regularly repeating affirmations such as, "I am safe," "I am loved," and "I am worthy," individuals can reprogram negative thought patterns that stem from childhood experiences. This practice helps in building self-esteem and fostering a positive self-image, which is crucial for emotional healing. Creative expression. Engaging in creative activities like drawing, painting, or playing musical instruments allows the inner child to express emotions freely. These activities provide a safe outlet for the inner child to explore and communicate feelings without judgment. Creative expression helps in reconnecting with the playful and spontaneous aspects of the self, promoting emotional release and healing. Spiritual guidance. New Age practices often involve connecting with higher vibrational beings or spirit guides for support and healing. This spiritual guidance can provide comfort, wisdom, and insight, helping individuals navigate their healing journey. Techniques such as meditation, prayer, and channeling are used to establish this connection and receive guidance. Psychological approaches. Cognitive behavioral techniques. Cognitive behavioral techniques are used to identify and reframe negative thought patterns. By challenging and changing these patterns, individuals can develop healthier ways of thinking and responding to situations. This approach helps in addressing the root causes of emotional distress and promoting mental well-being. Talk therapy. Talk therapy involves engaging in dialogue with a therapist to explore and resolve past trauma. Through this therapeutic relationship, individuals can gain insights into their behaviors and emotions, process unresolved issues, and develop coping strategies. Talk therapy provides a safe and supportive environment for healing and personal growth. Journaling. Journaling is a therapeutic practice that involves documenting thoughts and feelings to gain insights and process emotions. Writing letters to the inner child or keeping a daily journal can help individuals articulate their experiences, identify patterns, and work through unresolved issues. Journaling promotes self-reflection and emotional release. Behavioral rehearsal. Behavioral rehearsal involves practicing new behaviors and coping strategies in a controlled setting. By role-playing different scenarios, individuals can build confidence in their ability to assert themselves, set boundaries, and respond to challenging situations. This technique helps in developing practical skills for managing emotions and improving relationships. Mindfulness and relaxation techniques. Mindfulness and relaxation techniques are used to enhance self-awareness and emotional regulation. Practices such as mindfulness meditation, deep breathing exercises, and progressive muscle relaxation help individuals stay present, reduce stress, and manage emotional reactions. These techniques promote mental clarity and emotional stability. By incorporating these techniques and exercises, both New Age and psychological approaches offer comprehensive tools for inner child healing. Each method provides unique benefits, catering to different needs and preferences, and ultimately supporting individuals on their journey towards emotional well-being and personal empowerment. The impact and reasons to engage. Emotional and mental health. Engaging in inner child healing can have a profound impact on emotional and mental health. New Age practices provide a comprehensive approach to healing that addresses not just emotional wounds but also spiritual aspects. This holistic method offers a sense of wholeness and interconnectedness, helping individuals to feel more balanced and at peace. Techniques such as energy healing, meditation, and visualization are often used to release trapped emotions and promote overall well-being. On the other hand, psychological approaches offer reliable, research-backed methods for addressing psychological issues. These methods, grounded in scientific research, lead to improved mental health and emotional stability. Techniques such as cognitive behavioral therapy, CBT, psychodynamic therapy, and mindfulness are employed to help individuals reframe negative thought patterns, process past traumas, and develop healthier emotional responses. The structured nature of these therapies ensures that individuals receive consistent and effective support. Relationships and personal development. Inner child healing also plays a crucial role in improving relationships and fostering personal development. New Age practices encourage authenticity and healthier relationship dynamics by healing past wounds and fostering personal growth. By addressing and resolving childhood traumas, individuals can break free from negative patterns and engage in more genuine and supportive interactions with others. Practices such as affirmations, creative expression, and spiritual guidance help individuals to reconnect with their true selves and build stronger, more authentic relationships. Psychological approaches, meanwhile, help individuals understand and improve relationship patterns by providing tools for healthier interactions and personal development. Therapists work with clients to explore how past experiences influence current relationship dynamics and offer strategies to improve communication and emotional intimacy. Techniques such as talk therapy, journaling, and behavioral rehearsal are used to help individuals develop better coping mechanisms and build more fulfilling relationships. Overall well-being. Both New Age and psychological approaches to inner child healing promote overall well-being, albeit in different ways. New Age practices focus on holistic well-being by integrating various aspects of the self and encouraging spiritual growth. This approach fosters a sense of balance and harmony, helping individuals to feel more connected to themselves and the world around them. Techniques such as chakra balancing, sound healing, and spiritual practices are used to promote physical, emotional, and spiritual health. Psychological approaches, on the other hand, focus primarily on mental and emotional health, providing structured support for personal healing and growth. By addressing psychological issues through evidence-based methods, individuals can achieve greater emotional stability and mental clarity. Therapies such as CBT, mindfulness, and relaxation techniques are used to enhance self-awareness, emotional regulation, and overall mental health. In conclusion, engaging in inner child healing, whether through New Age or psychological approaches, offers profound benefits in emotional healing, self-esteem, relationship health, and personal empowerment. Each approach provides unique tools and perspectives, catering to different needs and preferences for those seeking to heal and grow. By addressing and healing past wounds, individuals can achieve greater emotional freedom, healthier relationships, and a more fulfilling life.